Joining us from down under at ASCO 2014 is Dr. Katrin Sjoquist. She is a medical oncologist and clinical researcher from the University of Sydney. Thanks for joining us.
Thanks, Tom. Pleasure to be here.
Let's talk about the work your group is doing in gynecological cancer, and in particular you have one poster that you have here on display.
Yeah, thanks, Tom. So I work with the Australia-New Zealand Gynecological Oncology Group, otherwise known as ASCO. And that's a collaborative trials group in Australia and New Zealand conducting investigator-initiated trials. And so we have a number of trials that we have initiated in Australia and also other trials that we join. I'm fortunate enough to be co-study chair for the REZOLVE trial, and that's a trial looking at trying to improve treatment for women with end-stage ovarian and related cancers who get recurrent ascites or fluid in the abdomen, and trying to find a better way of reducing the fluid buildup, relieving their discomfort, and hopefully improving the quality of their lives towards the end of that period, which can be really difficult to treat otherwise.
Now, what's the scope of the trial and what are your expectations or plans?
Yeah, so at the moment we're doing a pilot study going into full phase 2, which means that all the patients get the bevacizumab treatment. And the way it's given is that they have their ascites, their fluid build-up from the ovarian cancer in the abdomen. They have that drained off in the usual way that would happen, just with a catheter into the abdomen. And once all the fluid's gone, they put the bevacizumab directly back through that catheter, together with a small amount of fluid, and then the catheter's removed, so they can then leave hospital just in a day stay visit usually and go about their normal lives. We're looking to put on between 16 and 30 patients to work out if it's safe to use and hopefully get some idea of how active it is and how long it can delay the need to have recurrent taps, which are uncomfortable, unpleasant, and the fluid being there can really make life very uncomfortable for these women.
What can you tell us about the future that you have planned, including when results might be available?
So at the moment, we've got 5 patients on study. It's only being conducted in Australian centres at present. We expect to have our first 16 by the end of next year. And providing it's safe enough, we expect to recruit some more patients to really get a better idea of how well this works. So if it works really well, then we may not need to recruit as many patients, but hopefully we'll have results in a couple of years.
Okay, we'll come back and visit us when you do.
Thank you.
Thanks very much. Good luck to you.
Pleasure. Thanks.